All right, Raul, thank you. It is time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your most troubling skin questions. Let's get right to it, shall we?
You bet.
All right, our first question comes from Cynthia. She's 32 and she's from San Diego. She says, during my last pregnancy, I noticed some brown discoloration appear on my forehead and cheeks. What is this and what can I do? I know people that have had this. It's called mother's mask a lot of times, right?
Right. The medical term for it's called melasma, but we call it the mask of pregnancy. It's very common. Probably 30% of women during their lifetime will develop this. And the good news is that it's treatable. Sometimes we can treat it with topical medications, but when that isn't quite enough, I like to use a combination of lasers, and this is a patient who has melasma. And you can see in her after photo that there's probably a 90% improvement after one treatment using a combination of what's called the Fraxel Dual and a Q-switched alexandrite laser. So there's definitely options out there. Of course, cornerstone to success with this treatment is sun avoidance and sunblock.
Will it come back after you've had the lasers done?
It's not impossible. We've had some patients a year, maybe 2 years later, can come back, particularly if they have a bad day in the sun, meaning they didn't protect their skin.
Gotcha.
Yeah.
All right, let's get to our next question. And this is from Catherine in Del Mar. She's 48. She wants to know, I've noticed in the last 10 years my brows and upper eyelids are falling. Is there something besides surgery that will help this?
Let's take a look.
Okay, so this is the picture right here.
You can actually see, and it's very common again for women and men in their 40s and 50s to see descent or dropping of the brow and lid. So nowadays everyone's always looking for the quickest fix, so to speak, and with minimal invasive, no surgery. So we like to do a procedure called Althera, which uses focused ultrasound to tighten and lift the skin. That usually lasts about 2 to 3 years. A shorter term solution might be Botox, which will give you elevation of the brow as well.
So what you used on those pictures there was the first one that you're talking about?
Yes, that was the Althera, which uses the focused ultrasound, which will tighten skin. There's really no downtime with it. There's a little bit of heat sensation with the procedure, but that procedure that we did only took about 15 minutes to do.
Is it painful with the heat?
We use numbing cream to kind of mitigate any discomfort, but you can feel a little bit of the heat.
Okay.
Yeah.
All right, we have a question from a gentleman. This is Robert from Rancho Bernardo. He wants to know, I have a raised sore on my nose that hasn't healed in over 2 months. I'm concerned about it. Thank you for your advice. Oh, very polite, Robert.
That is very polite. I'm very glad that Robert sent this in, because looking at this spot on the nose, I'd be very concerned. First of all, the nose is one of the most common areas to develop a certain type of skin cancer called basal cell carcinoma. Now, basal cell carcinoma is very common. There's probably a couple million cases a year in the United States alone. The good news is that this type of cancer doesn't spread, it doesn't cause problems in other areas of the body, but it is locally destructive, meaning that it will continue to grow and get bigger and bigger. So it does need to be surgery probably in this case. Is
this especially concerning for you because of the shape of it, or the color, or the location, or all the above?
Well, you take into consideration anyone who has a sore, particularly in the head and neck area, that won't heal after maybe 2 months, that's a sign that it could be something like this basal cell. So given the size, the location, the history that the gentleman gave us, I'd be very concerned and definitely want to take a biopsy of that.
Gotcha. All right, our next question is from Rebecca in Crown Point. Rebecca says, I feel like I'm starting to look like my mom. I'm 51 years old. I have sagging in the area under my chin and jowls. Any non-surgical options for Rebecca? Let's go ahead and take a look here.
Yes, so again, with age, you can see descent or dropping of tissue because you lose volume in your face for one, and you lose the elasticity of the collagen and elastic tissue fibers. So you can see she's got a little descent underneath the chin, which gives a little bit of a jowling along the jawline. And so recently, within the last 6 months, a new procedure's come out, which is excellent. You know, every few years something earth-changing as far as in the world of cosmetic dermatology comes out, and this is one of those procedures. It's called ThermiTight.
This is it right here.
Yes. We're able to use a small probe, a probe that's about the size of a piece of spaghetti, and we can feed it under the skin while the skin is numb, so it's completely painless. I like to think of this as injectable radio frequency, which delivers heat, kind of like when we inject any product into the skin. So we can inject this probe into the skin, get it directly into the fat or the subcutaneous tissue, and deliver heat at a very specific temperature that we know will either melt the fat or will cause tissue contraction and tissue tightening.
Interesting. And then your results are going to last for about how long? This is before and after.
The nice thing about this is that it's painless, and results will probably last in the 3-year range.
Okay.
And it's usually, that's one treatment right there. So no need for surgery, no scars, and completely painless. So I'm really excited about this technology.
And that's something that you just do mostly on the chin and neck area?
No, actually we're using it on the stomach to tighten sagging skin in the stomach area. We're also using it above the knees. A very common complaint from our patients is saggy skin around the knees. So yeah, a lot of different areas. Back of the arms, for example, too.
Gotcha.
So if patients want to know more about this, we're actually going to do an open house this weekend, Saturday morning, and we're going to have a big discussion on this procedure.
Very good. Dr. Groff, thank you so much for being here. We really appreciate it. To get in touch with Dr. Groff, the information is up on your screen. He's located in the UTC area. Dr. William Groff, Cosmetic Laser Dermatology, located in the UTC area. The phone number is on your screen. We've also got it on our website, fox5sandiego.com. All right, Rob, we'll back over to you.